So first and foremost, on this very auspicious Sankranti day, where Sankranti is the moment when the sun starts rising northwards, upwards. So he enters the Makara Rashi and starts going upwards. And that's a very important festival in our country, across the country, from north to south to east to west. Everybody celebrates this event because what it does is brings more light, more warmth. After cold winter, it brings a longer day with a warmer weather. People can come out and do their things, and it brings new energy. Sun is known as a source of energy. So it brings a new energy and enthusiasm in the lives of people to venture on a new thing in their lives. It could be studies, it could be a new project, it could be building their houses, or marriages will happen. So a lot of things start happening after the Sankranti moment. So for us also, this I would call is a Sankranti moment in our healthcare mission. Because for so long we have been running hospitals, running it free, running it with high quality care. Now it's a given thing. What's next, what's new on a Sankranti days, if it is asked, then this is new. The new is that healthcare is not just being now the field of delivery, but it also the field of education that we are going to get into, which is the first of its kind. So inspiration for this comes to us from several of those great stalwarts of doctors who have worked in Sai mission, healthcare mission, for decades and given their everything for the sake of fulfilling the wish that all should have access to free quality healthcare, irrespective of caste, creed, or economic status, social status. So one such project in early 70s was undertaken by the very devoted and very capable and very efficient doctor, Dr. Sri Rajeshwari. And when we thought of building a medical college where the next generation should be trained as doctors, the first name that occurred to me, and rightfully so, was that of Dr. Sri Rajeshwari. Not because Sri Srinivas is a part of the healthcare mission, not because he's always in front of our eyes and in our minds, so it is this way. No, she really was a person of a great caliber. And somebody who was willing to sacrifice for the sake of the greater good of society. She was a woman of substance. She was a woman, as in today's parlance they say, who broke many glass ceilings in her career. And in those early 60s, 70s, she had worked and kind of rubbed shoulders with best of the physicians in the world. And for such a lady who was the peak of her career, to leave everything and come to a remote rural hamlet of Whitefield. Today Whitefield is a different world, but then she came, she set it up, and what started as a small clinic where she was everything. She was the compounder, she was the doctor, she was the cleaner, she was the dispensing medicines, she was the counselor, name it. No, one man or one woman army in this case. And till her last breath, she worked for the welfare of the people. Not one day she would take off. That is why she was known as Amma. People would fondly call her the Dr. Amma. So, doctor becoming an Amma it talks about what a doctor should be doing. Should feel like our own kith and kin, not somebody who is waiting to fleece us with false diagnosis and unnecessary tests and unwanted procedures. But somebody who really wanted to work for the welfare of the world. And I think that is the inspiration for this medical college and the building. And I am sure the generations of students who would join, they will derive inspiration from such stalwarts. And I am so glad that this is happening on a Sankranti day, because both festival-wise as well as from the point of view of a philosophy of transcending the ordinary and entering the realms of extraordinary is Sankranti. And that is what we are doing. Now doing free healthcare seems ordinary to me. Now it is a habit which may be puzzling or perplexing many people outside who ask, how do we do it? What is the model? What is the source of sustenance? How do we explain to them that love is everything for us? And if we truly love, in that love everything happens. How to explain to the world which does not understand what love is? So leave it at that. But that has become the regular thing, that has become the ordinary thing for us. The extraordinary thing is to transcend from this level to the next, which is to provide this facility of gaining a good quality medical education for free, making it accessible to the poor and the needy in the remote rural areas of the country. As we know, it's not a level playing field at this point in time when it comes to medical education. People who have been educated in English medium schools, in cities, have access to coaching, have access to some guidance. They are better prepared to crack the exams and get into a medical college. Or those who have enough wealth to pay for it, they can also get into that. But the real India lives in its villages. That's where patients are, and that's where we need doctors. How can an urban doctor go to a rural village and work? Very few people would do that. You can't take one or two example and generalize it. It doesn't happen. So we have to pick up our children from the rural areas, give them whatever is required. We will have to provide them training, even to get into a medical college. And then once they get into our medical college, enough inspiration and knowledge to go out as very efficient, good doctors with a compassionate heart which bleeds for the pain of others. They will put service before self, and that is how we will transform the society and the way healthcare is delivered, healthcare is received, taught and learnt. That is our way. And definitely it is something, a step that nobody has taken. So we are the first. So there will be a lot of unknowns in this journey. But that should not frighten us or make us feel uncomfortable. Doing what has never been done is an adventure. It's a challenge. It's fraught with fears. But more importantly, it's an adventure, and life is all about an adventure. So this is an adventure. Take it as somebody who conquers a peak, a Himalayan peak. It's an adventure. For an ordinary look, what kind of risk is that? If you fall from there, if there is an avalanche, if something happens, one may say anything. But for that person, the mountain climber, it's an achievement, it's an adventure. So we must take it like an adventure. Utsaham, sahasam, dhairyam, buddhi, shakti, parakramam. Wherever these 6 qualities are there. Utsaha, enthusiasm, sahasam, courage, dhairyam, the forbearance, the patience, buddhi, intelligence, shakti, strength, parakramam, a sense of adventure. Wherever these things are there, shadayate yatra tishtanti tatra daiva upahritam, it says. Wherever these 6 qualities are there, God himself is there with those people who have these qualities. So we must manifest these qualities, and this is our Himalayan peak to conquer. This is our summit that we must scale. To build an institution in a record time in a remote village, which is going to provide high quality free medical care to all. And what better day to choose than to start on a Sankranti day. Sankranti also has a word called Kranti in it. A Kranti is a revolution. A revolution has changed the course of history of humankind. And this is a revolution that is beginning today. And I must mind you, while you are as a team on the ground working here in a direct way, there are thousands of devotees from around the world who are supporting this noble cause, who also resonated with this idea that yes, it should be done. And I think in the background of this COVID pandemic, it has become even more pronounced, the need for such a college. It has become even more important. And that's why a lot of people from around the world, I have been talking to them and telling them about this idea, and they all have so well, they have taken this idea and said they all will work for it. Everything has to come together. All are equally partners in this great mission. And it's not just about me or you, it's about all of us. And when we work together, only this can happen. So for those who have come and advised me, why do you want to get into this another thing, and it may or may not succeed, I want to prove them wrong. And I want to prove them wrong with your help, because I alone can't do it. But I want to tell them that no, it is possible. It can be done. Many people have advised me, why don't you charge for some seats and make some seats free? Why don't you do this, subsidize a few? And I said no, education is basic right, and it should be made available to all for free. Just because you're born to a richer parent or a poorer parent should not be the reason why you should or you should not get education. It's basic. So that is the thought with which we are working. And I'm sure on this auspicious day, auspicious beginnings have happened. A new venture has started. And it's a wonderful coming together of both healthcare and education. Srinivas is the representative of healthcare mission. Everybody knows it. And our Narsimurti ji is a representative of the education mission. And I am representative of everybody. So in this moment, both of them are coming together. While this college will be under the Sri Sathya Sai University for Human Excellence, which stands for the word excellence, means the best that it can do. Nothing less than best would do. And the children in the university are being trained already as teachers who have already shown great results in terms of going out and working in our own campuses and training their next generation, inspiring them. It's already yielding results. We have already succeeded there, which was an experiment that started a couple of years ago. So with that confidence, we thought why it cannot be replicated in the healthcare side also. And that is why this was contemplated upon and now it's being executed. I must say that you are a part of a great revolution in the history of healthcare, in the history of mankind. And I cannot emphasize more about how privileged is each one of us to be a part of something like this. And where it will go from there, nobody can guess. How the child who studies and comes out and what he does to the world, we never know. We can never assess the totally true impact of what we are doing today. But it is a bridge that is being made, like the army of Rama had built the bridge to Lanka. And I call our Reddy brothers as Nala and Neela, who helped me build bridges to connect the haves and the have-nots, to connect those in need of medical care and those who can provide. And today another bridge is being built between those who want to study medicine but they can't afford to, versus those who want to give education in medicine but they are unable to give to the right people. It is building a bridge to connect both, and many more bridges will be built in the times to come. And I want to convey to all the devotees on this Sankranti day, like the sun that never stops rising every day. It works selflessly for the sake of others, burns himself out to give light, life, energy, warmth to thousands of beings, small and big, all creatures, and never tires himself of doing good to others. And Sankranti is about that sun. We celebrate that sun, we worship that sun for what he does for the world in his own silent way, consistently, perennially. We must derive inspiration from that sun god, who doesn't mind burning himself out. I know one day the sun will be exhausted. It will become another dark black mass, bereft of all its heat and light. But he doesn't mind. He doesn't want to keep it, because that is the way sun is. To give oneself away is the essence of life. To hold is death. To share is life. And sun is all about life on this earth. And sun is all about sharing at any cost. So we must derive some inspiration on this Sankranti from that sun god whom we worship on this day. And try to lead our lives selflessly, fearlessly, which is being divine. I define divinity as selflessness and fearlessness. Anybody who is expressing these two qualities, they are already becoming divine. So this is a mission where we have to be selfless. We can't see the clock and work. Sometimes we'll have to keep our personal things, our personal priorities aside and work for the greater cause. I'm not saying you should spoil your health and things like that. You shouldn't be the first patient to be admitted. But at the same time, you will have to prioritize this above everything else in life at this moment. Even it means a loss of a little leisure or some personal time or maybe some finances here and there. Anything and everything is okay as long as we are able to execute this. Second thing I want to also tell is that you must be fearless, because you're doing something for the good of others. And you should never be afraid. The great things have happened in this world only by fearless people. Somebody had ventured out in the sea and found newer lands and created new countries. That's fearlessness. Everything is about fearlessness, and with God by our side, we can afford to be selfless, we can afford to be fearless without efforts. So once again, I am remembering our most dearest Rajeshwari Amma, and whose name adorns this edifice, and whose life would continue to inspire many, many generations of medical professionals. And in her memory, we dedicate this building, And what better way to do it than on this auspicious day? So I would again wish you all the very best for this wonderful venture. And on behalf of everyone, I also want to convey gratitude to all of you for having taken up this task. And to all the devotees who are a part of this great venture, to all of them, Sankranti blessings, best wishes, and lot of fearlessness and selflessness for this year.